Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Thanks for everybody joining, and welcome to our webinar today on leveraging interoperability for better home care outcomes. Just want to talk through a few housekeeping items. Everybody on the line today will be muted. Feel free to chat in any questions that you may have as we're going through today's discussion. We will not be doing a live Q&A session, but we will follow up with you directly to address any questions that you send in as we're speaking today. I want to thank everybody for jumping on the line today. We're excited to talk to you about interoperability. It's been a hot topic in our industry for quite some time, and COVID's really driven that too over the past year and bolstered that a little bit more. So I think we'll start with some introductions today. So if we can go ahead and transition to our next slide. Tim, I'll kick it over to you to start off with an intro from your side.
Thank you, Jared, and thanks everyone for joining us this afternoon. As Jared said, interoperability's really been a hot topic for a few years now, maybe even before that. And so I'm excited to spend some time with Jared and with those of you that have joined us today or are listening later to the recorded version to talk about how interoperability really helps us expand the power of what we're doing. And so as you see on the slide, my name is Tim Ingram. I'm Senior Vice President of Business Development at Axxess, and I have the pleasure of having been at Axxess for a little over 3 years now. And one of the ways that we extend the power of Axxess is through our partnerships with great teams and great people like Jared Robey and the WorldView team. And so, Jared, I'll turn it back to you and let you introduce, and we'll dive in.
Yeah, sounds great. Well, thank you. And as Tim said, my name is Jared Robey. I'm Vice President of our Healthcare Division here at WorldView. Been with the company for about 8 years now, and I'm responsible for leading our strategy on the healthcare side of the business, and then also have leadership over the sales, marketing, and account management divisions. And so I'm just really excited to be here today with Tim. Love every chance I get to work with him. And so on the right side of your slide here that you see on your screen, you'll see just a quick agenda of some of the items that we're going to run through today. So we'll start with why interoperability is essential for your organization, some of the benefits that are tied to interoperability. We'll talk through some best practices from the Axxess playbook, and then we're going to drill into kind of the partnership that WorldView and Axxess has and what those integration points and how they can benefit your organization from a document management perspective. So to start with, we're going to move into a slide that's kind of a get to know WorldView slide to begin with. There's probably several people on here that may not have heard of our organization, and then we might have some customers on here, so I figured it'd be good to start with kind of an intro. Our organization has actually been around for over 20 years now, providing document management services, and specifically in the healthcare industry where we're focused is referral processing, orders management, and medical records. And really, we key off of 4 values here at WorldView that I just wanted to break down real quickly. And that's going to be innovation, trust, creativity, and customer service. And so one of the favorite parts of my position is the chances that I get to collaborate with our customers and come up with new and innovative ideas to help them grow their business through the technology that we provide. And a lot of that comes through very transparent conversations that help us build trust with those organizations. And ultimately that trust helps us build long-term relationships. And that's the goal for every one of our clients here at WorldView. From a creativity perspective, everybody at WorldView is encouraged to think outside the box. We know that every one of you on the line is hit with challenges, what probably feels like on a daily basis, whether that's regulation challenges, whether that's internal challenges. There's always something to be solving for, and that's what we have our team looking into at all times. So really focused on creativity. And then last but not least, really customer service is kind of what makes us who we are. We realize that with any technology, not everything's going to be perfect, but if you can respond in a timely fashion to those requests, those resolutions, we feel like that goes a long way with our customers. So we really try to focus in that area. And so at this point in time, I want to pass it back over to Tim. He's going to talk a little bit about Axxess's integrations, vision and mission from their side before we get into the other topics today.
Thank you, Jared. And, you know, one of the reasons I always enjoy spending time with you and the WorldView team is on the prior slide, you had trust and creativity as two of the things that you engage in. And that speaks very deeply to me and our culture at Axxess, because we always talk about may the best idea win. And that's creativity, if you will. And then the trust. I read an article recently about trust and trustworthiness, and it just falls right in line with what we're trying to do together. And that's build rapport and relationship with each other between Axxess and WorldView for the betterment of our partner organizations or our clients that are using both WorldView and Axxess. And what you see on the slide now is our integration vision. And I want to take a step a little higher than that and talk about the Axxess vision and mission. And that's because even though the integrations vision and mission is what you see now, every team at Axxess may have their own dedicated team vision and mission, but it all ultimately ties into the Axxess vision and mission, which is in essence speaking to the fact that we believe deeply that the future of healthcare is in the home. And so our Axxess vision is to empower healthcare organizations and professionals with the world's best technology solutions. And then our mission is to provide healthcare professionals and organizations with the world's best technology solutions. And then that ties in closely with our integration vision and mission. And when we really made a dedicated focus a few years ago on trying to expand the bandwidth of our solutions, we realized that what we can do as Axxess will never be as good as what we can do with partners like WorldView, where we can, in essence, work beyond ourselves. And so you see this integration vision to deliver a fully integrated, seamless set of solutions for healthcare organizations and be the most preferred industry partner. I won't put Jared on the spot and ask if we are his favorite organization to work with, but that is our goal internally at Axxess, such that every other provider, every other vendor, if you will, in our industry wants to work and to have a relationship with Axxess. And then that drives our mission to empower healthcare organizations with the most seamless, integrated technology solutions. And at the core, that means we want to, as much as possible, give all of our users the ability to log into Axxess at the beginning of the day and never be forced to go to other solutions to get their work done. And that's why we continue to refine what we're doing with WorldView to take advantage of the things that they have done from a document management standpoint and make all of that as available as we technologically can within the Axxess solution.
Perfect. Thank you, Tim. And, you know, as we transition to this next slide, we talked about interoperability being around and being a focus for a couple years now. And the demand for electronic information exchange amongst, you know, stakeholders in our industry has grown substantially. And so not is it so much of an ask anymore as it may be a demand from a lot of the stakeholders that you work with. And so at this point in time, we really want to help our organizations do as much as they can to have their systems connected, every chosen system connected to be able to help their teams operate the most efficient way. And that's all in an effort to do that efficiently and then improve quality and safety as well for healthcare delivery. And so as we transition to the next slide here, we'll talk about setting up your agency for success today. So there's a lot of you that are already having your healthcare records in an electronic fashion today. And then there's maybe some of you on here that are still on paper. And the goal is not only to have those health records electronic today, but to be able to execute every step of the process, every step of the workflow that you have in conjunction with your patient care electronically. And that's going to help your teams operate more efficiently and ultimately help your organization save on expenses. And so 4 areas that we're going to talk through on the next few slides are going to be patient centricity, streamline processes, employee satisfaction, and a single source for solutions.
And so, Jared, if I could add one thing in here right quick, talking about setting up your agency for success. And as we work together, I think you could attest to the fact at WorldView that what we try to do, there's just a quote that we use often, never let the perfect be the enemy of the essential. And
Sure.
so just like WorldView is often adding additional functionality to do all four of these things better that you've got on the slide now, at Axxess, we're trying to do the same thing. And so we may release bits and pieces, if you will, of what will eventually be this beautiful interface between Axxess and WorldView so that we can bring our clients along as we're doing that. So instead of making everyone wait for a completely finished product, we believe that there's value in releasing what we can as we go and making sure that we are providing a continuously improving interface between Axxess and WorldView, which ultimately helps the clients and the patients that our organizations are serving.
Well, that's a good point because, you know, as you learn too, as you're releasing those bits and pieces, and as we've done that together, you know, the requirements that may be here today may be different tomorrow, right? And so what we want today may look different, and by doing that, we can be nimble and change as we go and make sure that our clients are getting the best experience as a part of that. So thanks for adding that as well. And so as we transition into the next slide, real quick to start with, we'll focus on patient centricity. And, you know, this is defined simply as putting the patient first, right? And so what I've found is, you know, all of us on the line today, myself included, and Tim, we're all in this industry because we want to provide excellent care for patients. You know, a lot of you are providing that care. We're helping support that mission. And it can become difficult because of the documentation requirements and the different systems that you all have to get into to support, you know, the different facets of your business. And so not only do you have that, but you also have some other challenges that we all don't like to talk about, but there's, you know, nefarious people and acts out there trying to gain access to your patient data, to your agency's data. And there's just a lot of challenges out there where sometimes organizations get, you know, so bogged down with focusing on the security of the platforms that they're using and making sure that everything is compliant, that, you know, that focus on the patient unfortunately gets put a little bit to the wayside, or at least it's not as much as it could be if you're focused on that interoperability and all the systems are working together to manage that security and that compliancy for you. So that's kind of what we want to focus here is how do we leverage technology and leverage the interoperability between systems to make sure that I'm not needing to check up on different parts of my system, make sure my access is secure, my information is secure, but let our partners do that for that so that I can spend time when I'm on site with the patient caring for that patient versus, you know, finagling with technology and making sure that it's working appropriately. So I'd like to get your thoughts on this slide here, Tim, as well.
Yeah, Jared, you know, one of the things that I like about this slide, the patient centricity, really ties into one of the value propositions that we have at Axxess, and that's ease of use. And exactly what you said, if my focus has to be on the security of my system and my solutions, then already I am losing focus on what should matter the most, and that's taking great care of patients and families in the environment that they are in. And so the focus on patient centricity can either be hindered or enhanced when you look at interoperability. And so when you get to partner with people like Axxess does with WorldView, and you know that there's a focus on protecting that PHI in a way that does not encumber the staff that are using it, then that in turn then becomes a beautiful solution that you can use, and your focus is really where it should be, and that's on the patient delivery.
Absolutely, absolutely. Well, good. So we'll transition now to the next topic, and that's just, you know, streamlining processes. And there's a ton of workarounds or manual tasks that you or your teams are doing on a daily basis, and I think everybody could probably agree with that. Nobody's probably quite to the point where they want to be from an interoperability perspective or what that journey looks like for them. And so, you know, I talk to organizations or agencies all the time about some of those workarounds. And, you know, one common one is taking data from one system, downloading that to my desktop or to a location, and rekeying that information into another system only to download it back from that system, put it in the original system. You know, so you have these multi-step approaches that really, it boils down to a lot of time, a lot of effort for your people to be able to accomplish what could otherwise be a fairly simple task through interoperability. And, the ideal goal is for these systems to simultaneously update, right? So them to stay in sync at all times. And so as you're keying information into, Axxess, for example, if you're a mutual customer of Axxess and WorldView, the information that's being put there is automatically updating in the WorldView system, right? And people are getting notified. They can take next steps or take action on the next part of that workflow without needing to wait on, communication from somebody else. So all of these processes are helping our teams work more efficiently. We can do that with less people, less touches, and then we can focus on the things that are more important, like we've talked about with the patient care or other items just within your organization. So, Tim, you want to give your thoughts on this slide here as well?
Yeah, Jared, I mentioned earlier the alignment, if you will, between WorldView and Axxess and the way we think about work. And this actually is a bullet point on one of the slides that I'm going to talk about later about streamlining your operations. And it speaks to the same thing, where we want to eliminate as much as humanly possible the requirement that you have to do any duplicate data entry. If information is in one solution, we should find a way then to make sure it gets in the other solution. And that's what we're ultimately working on together between Axxess and WorldView.
Yep, absolutely. Well, perfect. And so here's, actually this one sticks out probably to me more than any of these other slides actually, and that's employee satisfaction. And so, the people within your organization, within our organization are our most valuable resources. And they're key to, keeping a smooth running business. And so what we've found is leveraging interoperability actually helps increase employee satisfaction and ultimately reduces churn. And really what that boils down to in my mind is people are feeling more accomplished. They're getting more done in their day. They're able to focus on more important tasks, more important items with the patient. All of that's tied into this. And so when we look at a few of these data points on here, such as reduce redundant data entry and keystrokes. So Tim just talked about this a moment ago. When you're not having to do that and it's being automatically updated in those complementary systems like a WorldView to Axxess, you're saving 50+% in time of having to go in and put that information into those systems. And so you're skipping those unnecessary steps and focusing on that patient and not the documentation when you're sitting right there with the patient or, making phone calls, whatever the case may be. The other good part to this is, just opening the lines of communication. And so I don't necessarily, make a phone call to somebody if I'm within an agency and they don't know what's not going on, because through interoperability, they're getting those notifications, they're getting that information in real time. And so when that isn't there and you're waiting on those manual uploads or those workarounds that we talked about, those people can't be prepared for that phone call. However, now they can be. So when I call, they know exactly what I'm talking about, and we can talk openly about the information that's right there in front of them. So Tim, your thoughts on employee satisfaction?
Jared, again, we are extremely well aligned between Axxess and WorldView on this. And as you were speaking, I'm reminded of the quote, if I take care of my employees will take care of my business. I believe that was a Steve Jobs quote. Forgive me if I'm attributing that to the wrong person, but it speaks exactly to what you're talking about and what's on this slide. Through interoperability, we have the ability with partners to be able to provide a more satisfying job situation for employees. And if the employees are satisfied, they are ultimately, again, going to be able to focus on what matters, and that's taking care of patients and families.
Absolutely, absolutely. And so the last slide we have here before we get into some more Axxess focus slides is really just tied to a single source for solutions. And so, like Tim mentioned earlier, we're integrating in a way and still striving to be even better all the time to where it almost feels like you're in one solution. And in some cases, you are in one solution, right? And so even if it is multiple systems, and whether that's related to our two organizations or anybody that you're working with on interoperability, even if you're working in separate solutions, if they're integrated, a lot of times it can feel like one because those systems are going to be in sync all the time. And the goal with that is really to create efficiencies and reduce expenses like we talked about. And so we have a quick quote here from a mutual customer of Axxess and WorldView, Aspire Home Care. And Once they were able to implement the integration that we have between our two organizations, they quickly noticed that they were saving about 20 hours a week just on time spent documentation-wise, those manual tasks that I mentioned, the workarounds and things like that, and ultimately reduced overhead. I think we saw you know, a little bit of a boom in need for our services. I know specifically, Tim, and I'll give you a chance to chime in, but during COVID, you know, when it hit last March, having our system in place really prevented the need for a lot of those agencies or the offices that we work with to have people right there, right? So all of their documentation was flowing into a hosted environment. They could access it from home, and they could keep up with their day-to-day work because they weren't so reliant upon, you know, touching a physical piece of documentation or whatever the case may be. So in addition to just time savings, there's a lot of benefits that come along with this, some unexpected, like tied to COVID and things like that. But Tim, I'll turn it over to you to give your thoughts here as well.
Jared, you're right. And you know, when you think about how what we do in particular, but really business in general has changed and may never go back to the way it was in 2019 before the pandemic, interoperability is almost a requirement now, in the sense that having the ability to have something like this where you can be in front of someone if you need to be, for instance, a physician talking about orders that are outstanding. But when you don't have to be, or when they don't want you to be because of a pandemic that may come in the future different from what we have right now, having this interoperability so that you can have that information exchange between your organization and theirs without actually having to have physical contact, that again gives you the ability to focus your time and your efforts on what you need to. And I think about Aspire and just that one organization in one office having the ability to, in essence, eliminate the equivalent or repurpose, not necessarily eliminate, but repurpose the equivalent of one part-time employee. That can become huge for an agency in terms of what else they are able to do for their patients and their families.
Yep, absolutely. And I can't agree more. And, you know, we talk about that. One of the first slides when I was kind of introducing WorldView and, you know, innovation, creativity, things like that. And I tell you what, 2020 was a year that we were probably the most innovative we've ever been, working through a pandemic and making sure there's solutions, creative solutions, so that everybody can, you know, accomplish the work that they need to when they can't go to the physician's office, or if they can't come to their own office. So couldn't agree more there. So at this point, we'll transition into kind of an integration slide from the Axxess side, and then Tim will talk through the integration that we have specific to WorldView. So Tim, I'll turn it over to you.
Yes, thank you again, Jared. And for those that are on with us now and listening to the recorded version, don't feel like you have to take a lot of notes. I'm not going to do a complete education on how to utilize WorldView through Axxess, but I do want to hit on some highlights to really focus on why interoperability matters in general, and then how we make it matter between Axxess and WorldView. But before we get to that, just one slide right here. I love this slide because it helps me think a little differently about interoperability. And, you know, a lot of people throw that term around, but what we've done is look at the different solutions that are on the market right now and say, okay, what bucket, if you will, does that fit in? What area of our client's business are we improving with this new interoperability partner, if you will? And so we really bucketed those into four categories: clinical, financial, operational, and then technology. And what I would say is more than likely the ones in the technology bucket are things that either you take for granted because you're so used to having it, or you don't think about because it's all behind the scenes. And that's, Jared, one of the challenges we have sometimes with WorldView, demonstrating WorldView to our clients when they call and ask us questions is, okay, what's it actually doing within the solution? And some of the reason there's a challenge is because so much of the beauty of interoperability happens behind the scenes, if you will. And so that's where that technology bucket really comes into play. What can we do that no one even notices that's going to make their life better because we have built out interoperability with other technology solutions? But then the ones that really impact our agencies, particularly our shared clients, are those clinical, financial, and operational buckets. And so as we transition through these next slides, first what we want to do is look at exactly what's in the Axxess solution. And so on the next slide, we'll start looking at what we have within Axxess as it relates to WorldView. And so if we could move on to the next slide. There we go. Okay, sorry, I forgot about this one slide. Jared, we talked about, if you could, thank you. Okay, we talked about seamless document management. And what we're talking about here, even though we're going to spend a few slides looking at the Axxess solution, we're talking about what WorldView gives you the ability to do within the Axxess solution. And Jared mentioned several bullet points earlier, and I believe every one of these in a way relates to some of what you said, Jared. First, we did this because we know that WorldView can help streamline operations, and you see some data there or some details about how we do that. And then ensuring compliance, Jared, you talked about protecting PHI, and that's where we do that. We also ensure compliance within the organization such that people can see what was modified by whom within their organization. And so that ensures not only compliance with your processes, but also compliance with regulations. And then we mentioned earlier, reducing overhead. We give you the ability to repurpose your efforts as an organization because we're eliminating things that technology should be able to do for you. And so all of that together really provides seamless document management. And Jared, I'll pause there and see if you want to add anything before we actually get into the solution.
No, I think you're covering it very well at this point. So I think there's a few more slides that maybe goes through that Axxess system, and then we'll dive into the details of WorldView itself.
Okay. Yeah, so what you're looking at now is really just the beginning. And again, for those listening in, I'm not going to go through all the details, and so don't feel like I'm going to read every slide that's on here. But one of the things I want you to pay attention to is literally how easy it is to get started with WorldView, but then also how easy it is to utilize or take advantage of the WorldView technology within the Axxess solution. And for those on here who are already Axxess clients, it literally is as simple as just a couple of clicks of buttons within your solution to add the WorldView interface. And you see at the bottom, there's a couple of emails there. You can reach out to WorldView if you're not a client of theirs yet. If you are already a client of WorldView and you're an Axxess client, you can reach out to us and we can help walk you through that. But literally just the click of a button within the Axxess solutions under the company setup and integrations, you have the ability to turn on this great functionality. And so we'll look at some of that functionality on the next, I believe, 7 or 8 slides. We'll dig into some of the details. So once you have activated the Axxess and the WorldView enablement, if you will, within our solution, you're going to be able to manage patient documents. And so on this one, and I believe 1 or 2 slides after this, we'll look at managing patient documents. And you can do that by simply going to choosing your patient, then your patient charts, and then the documents within that patient chart. And in that document section, you're going to see some really easy functionality to be able to attach documents. And you can do that if you have scanned those documents in, and Jared will talk about that when he's presenting the WorldView solution. But if you scan those documents in and you've saved them somewhere else on your device, then you've got the ability to bring those into the patient record really with just, again, a couple of clicks of a buttons within the patient's chart. And so as we move to the next slide, what we're going to look at next in this is managing orders. And managing orders is almost just as simple as managing patient documents. Yes, you've got physicians that are involved, and so there's a little more involved in managing the orders than just attaching and managing the documents. But what you're going to be able to do is, again, simply go in through the orders, and you're going to be able to find your physicians and edit that physician in the order delivery method. And in there, you can choose to show that you want to utilize the Axxess Physician Portal. And then once you've chosen the Axxess Physician Portal or the different way that you want to manage that, if you can back up for 1 second to the prior slide, please. I want to highlight one more thing. Thank you. Okay, so once you've chosen the delivery method appropriately, all of the orders that are then sent either by mail or by fax are going to flow through WorldView. And so they, in essence, are managing those orders in very similar fashion to the way they're managing the documents that we talked about earlier. And now we can go to the next slide. And on this one, again, we're just showing another view of that. You can then, once you've done that, they will appear in the orders to be sent, and you can then choose. There's a couple of more pieces of functionality. Again, I don't intend for this to be a step-by-step instruction. For those who are Axxess clients, you can find much more detail within our help center, and you can see some videos there and some step-by-step instructions on doing this. But my goal here is to show how simple it is within the Axxess solution to take advantage of the great things that WorldView is offering through this. And again, on the orders management, what you see on this slide, columns on the orders pending signature are going to show you the age of that order. And then there is a number that's generated for tracking purposes. And Jared, I'm sure you'll get into the smart things that you guys are using and how you're tracking those both outside and inside the Axxess solution here in a minute. So I don't want to focus too much on those details. But this slide also gives you the ability to bulk select orders and take action on those. So you can select orders individually and do things individually, or you can choose a group of orders and do bulk editing or bulk updating, if you will, to those within our solution. And again, that's all done within the managing order section of the Axxess software solution. I think I have one more slide on here, Jared, maybe two. Okay, no, I was right. This is the last one. Okay, so again, on the orders management, what you're looking at now is the ability to see historical information through the WorldView integration that we've got. And again, you go into your orders management and you can focus on the orders history. And so you can see what orders were received, what happened with those orders, where's the signature. And again, in just a second, I'm going to turn it back over to Jared, and he'll talk about how that actually happens and how those random documents and orders, if you will, get into our solution and then attached to the right patient at the same time. And so again, hopefully you've seen in these last few slides, it's very easy, number one, to activate the interface between Axxess and WorldView. And then number two, how to take advantage of the power of what WorldView offers through their incredible technology as well. And so, Jared, I'll turn it back over to you and let you talk about the WorldView side, and then we can sort of tie it in together after that.
Yeah, thanks. That's a great precursor for kind of the solutions that I'll talk through here, and I appreciate you running through the Axxess slides. So as Tim mentioned, a lot of those may look familiar to you, and want to give you an idea of how our system works in conjunction and complements the Axxess system. So I'm going to talk through really three main pieces of functionality today, and then talk through a brand new product that ties into one of these, which is order tracking. And so I'll go through order tracking, which is an automated way to send out your documents to physicians and get those back into Axxess. But we'll also talk through MedAttach, which is bringing documents inbound. So not just orders, but that could be new referrals, that can be other medical records. And then also, last but not least, we have state-of-the-art mobile complete app is what we call it, because there's actually several pieces of functionality that give your teams in the field the access to accomplish a lot of their work and get that immediately back to your back office and ultimately into Axxess in an expedited fashion. So we'll go ahead and start with order tracking to begin with. And so Tim was kind of outlining the way you would create those orders, and if we can switch to the next slide here. Might be just delayed here on my side for a second. There we go. And yes. So there we go. So we have our order tracking slide here. So as Tim talked through his screenshots there, when you're creating new orders inside the Axxess system and you go through that approval process, we have an integration in place that allows those to flow directly into the WorldView system. And what we're doing is adding intelligence to this process and automation. So what we work with all of our clients on is understanding when, how, and to who their orders need to go to. And we set up custom workflows on our side to take the orders from Axxess and then automatically drop those in buckets for when they need to go out to the physician, how often. So if we send it out on day one when we receive the order from Axxess, how often do we need to follow up on that? So every 7 days, for example, every 3 days, that's usually kind of state dependent. But what we're doing, and a coworker of mine probably says it best, he says we're putting this on autopilot, essentially. It's like a car that's driving itself, right? And at any time, you could potentially take the wheel if you want to stop something from happening or you're not expecting something back. Sure, you can jump in and take action and make sure that the system is doing what you want it to. But for the most part, it's going to be fully automated. And we're going to continue to track these orders through our system until that receipt occurs and we attach it back into Axxess so that that billing process can occur for your organization. And so what we found from our side is that our agencies typically see over 75% of their orders returned within 1 week, 7 days. And so when we're talking about, accounts receivable and being able to bill, that's significant. We're also able to improve physician satisfaction. And so we talked a little bit about us managing the orders on the outbound side from a fax perspective, but all of your orders can technically be tracked through our system. So whether those are faxed, whether they're emailed, whether they're printed off, and that physician still requires that hard copy, or maybe you're getting an electronic signature through our mobile app, we want to provide a variety of ways and as many ways as we can for you to get that order in front of the physician, be able to obtain that signature so that you can bill accordingly and that you don't have this long list of outstanding orders that are, over 30 days. And so that's our goal with this. And tied to the automation, we'll give you automated reports in what we call our report dashboards. And so this is going to be real time. So you're able to pick up any sort of delays in the process or things that just don't feel right, don't look right, so that you can take the appropriate action, like I said, taking it off that autopilot and then and grabbing hold of the steering wheel, if you will. So that's order tracking at a high level. Next, we'll talk through what we coin as MedAttach. And so that's going to be the inbound side of documents coming back in. And so that would be those orders, that could be new referrals, that could be labs, consents, really anything that you ultimately want associated with that patient chart inside of Axxess. And so our goal here is to do as much upfront pre-processing on the documentation that you receive, so that it's very few clicks, very few seconds to review these documents to then pass them through the integration that we have in with Axxess. So if you don't have anything like this in place today, probably what it looks like for you is you may have inbound faxes that are either printed or sent to email or whatever the case may be. You may have to scan them back in. You may have to do that individually, open them up, rename them, do an upload. There's several steps ultimately to get that in. And that goes back to a previous slide where we talked about those manual tasks or, those workarounds to make things work that they ultimately do work, but they just take more time, right? And so what we want to do and what we do with our clients today is work with them to set up as much of that automation up front. And so if you have, 10 documents that you receive a high volume of on a daily basis that look and feel the same way every time, we can build those templates in our system to say, okay, I recognize what this document is. It's a lab or it's a consent form. It's for this patient because we're able to do OCR on the document and say, hey, this patient lines up with a record that we have from Axxess. And all of a sudden, we're populating all of this information associated with a document that's there. And then a user from your side is basically doing verification and saying, yep, everything looks good. They'll click a button within the WorldView system, and that's going to pass through the integration that we have in place with Axxess and ultimately reside in that patient chart in a seamless fashion. And so one of the nice benefits above and beyond, the reduction in time spent from maybe what is a couple minutes down to an average of 10 seconds is just that ability to know that these documents are always going to be placed in the correct location, in the correct patient chart, and it's going to be standardized, right? So no matter who's doing it, we're handling the work behind the scenes, so it's going to line up every time. And then last but not least, from kind of those core products, we'll talk through Mobile Complete. And so we've, over the years had a lot of clients that have partnered with various organizations that have a mobile app, and typically that mobile app is focused in one area. So maybe it's a secure a capability to capture documents in the field. Maybe it's for wounds. Maybe it's secure communication. Well, we are seeing these clients partnering with several organizations to accomplish this, and ultimately go into several apps. And we said, hey, we can help our customers, and we can do this inside of our system, tie it into the back office application that they're already using, but provide these amazing tools in the field for clinicians, for the sales and marketing team. And so that's exactly what we did. And a few years ago, we went to work on that, and it's come to fruition. And so now we have the ability to give our clients the app in their hand in the field to be able to securely capture documents. So it's never going to reside on the device, on the camera roll, anything like that. And they can instantaneously send all their images, all their communications that they're securely exchanging amongst the team right back to the back office and ultimately again into that patient chart inside of Axxess. That is the same for wounds as well. So we have some organizations that are probably on the line today that do wound care, and we took this a step further and said, hey, let's automate the measurements for wounds. So now we're helping organizations automatically and standardize the measurements for wounds and get that into Axxess as well. But then last but not least, tied into the order tracking pieces for those sales and marketing teams that do have the ability to get into the physician's office. They can pull up all the outstanding orders for a physician and they can get electronic sign off right then and there and pass that directly back into Axxess. So just several things that I'm talking through and talking 100 miles per hour, but there's a lot to go through that all ultimately add value to your organization while seamlessly tying into the Axxess system. Before I go to eSign, Tim, is there anything that you wanted to ask about or touch on there?
No, Jared, just a compliment on the work that you did. You mentioned that it took a while to build the wound measurement. I think the wound measurement and really all the other things that you're talking about are a perfect example of how we can extend the power of each other's solutions by partnering together. So we have information that our organizations need to keep track of. You provide an easy to use solution that helps them get that information in and ingest it appropriately without doing additional manual labor that you mentioned, and it becomes a beautiful partnership that really just will improve over time. What we've got today with WorldView, I can almost guarantee is not going to look. You mentioned this earlier. It's not going to look like what our interface with WorldView will look like in a year, 2 years, 5 years, because technology is constantly evolving, and we are continuously thinking of ways that we can improve this. It is not our interface with WorldView is not a static thing that it's done now, and so we're just finished with it. We continuously work to improve it, and it's obvious y'all are doing the same thing on your end.
Yeah, absolutely. And speaking of evolving and the innovation topic that we talked about before, if we slide to this next slide, and I think is the final slide prior to just our contact information here, but our newest product that we've released really ties into that order tracking functionality that Tim and I have been discussing. And so we talked about, inside WorldView, we want to provide as many potential ways to get orders in front of the physicians who ultimately need to sign those. And so, when COVID hit last year, we were using that creativity skill of ours and went to work on what we call WorldView e-signature. And this is, getting away from some of the faxing that we're doing or hand deliver or through our mobile app, but this is actually, supplying a secure email to the physicians automatically the same way that, a fax will go out through our system, and allowing them to sign their orders electronically through an intuitive web interface. And so what's nice about this is as they're receiving the email, when they want to access those orders, they're not responsible for putting in credentials and stuff like that. We want to make it as easy as possible on them. So what we do is go through a dual factor authentication. So we have the email, they can get text to code, for example, to access that as the dual authentication. And then all of the orders from Axxess that have flown through our system and ultimately to the physician are available for them to review and sign through this web interface on their phone, on their tablet, on their laptop, wherever and whenever they are. So if they're not in the office because there's an outbreak, for example, they can still continue to sign their orders and get those back to you versus going in and grabbing them off the fax machine, for example. So this is a huge time saver. We're seeing a lot of traction with this amongst our clients and the physicians that they work with. So something to keep in mind, because as we talk about evolving technology, interoperability, I really feel strongly that this is going to continue to be the next evolution in some of the solutions that we provide. So I think, although we're providing this for physicians and order signatures today, we have a lot of plans to expand what that looks like, to getting that in the hands of patients, to getting, delivering anything and everything through this in a secure fashion, but an efficient fashion for your organization. So, perfect. So I know that was a lot of information there. On our next slide, I think we have our contact information, if I'm not mistaken, and there it is. So just to kind of wrap up, I guess I'll say thank you first, Tim, and I'll let you jump in. But I really do appreciate the folks that jumped on the line today. I hope you were able to take some nuggets to potentially explore a little bit more. I'm happy to answer any questions about Axxess's interface with WorldView, the functionality that we specifically provide. But my email information is down there, so feel free to reach out. Also, if there are any questions that came in, we will be reaching out to address those as well. And Tim, I'll turn it over to you real quick.
Okay, thank you, Jared, and thanks again for spending time with me and for the people that have joined and those who will listen to the recording later. We'll provide, as you said, we'll provide answers to any questions. My contact information is there. Please reach out to me if you have any questions. We also have an email for integrations that goes to a number of our interface or our integrations team members so that we can respond as quickly as possible. And that's simply integrations@axxess.com, or you can reach me at my first initial, last name, tingram@axxess.com. Jared, thank you so much. And thank you to the WorldView team for putting this on and for allowing us to be a guest with you today to talk about interoperability and how together we are improving care in the home.
No, absolutely. I enjoy every opportunity we have to collaborate on these items. So thanks very much, Tim, and thank you for everybody that joined. Have a great afternoon.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on software advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.